Hi, I'm back for day 2 of my month-long series through October on hormones. I will be talking today about estrogen and specifically the symptoms of having high estrogen or low estrogen, because remember, the body always wants to be in balance, and estrogen needs to be balanced with progesterone. But sometimes we can get out of balance, particularly due to phytoestrogens that we have in some of our plant-based foods, but also through many of the chemicals and ingredients that are going into products that we use on a regular basis, like shampoos and soaps and skin lotions, etc., etc. And the body treats it as estrogen, and that estrogen builds up in our body. As we go through the month, I'll be talking about all different types of hormones, all of our sex hormones, as well as cortisol. But today, it's all about estrogen. And then tomorrow, and when I come back, tomorrow, I'll be talking about progesterone and continue that through the week. So these symptoms, of course, aren't necessarily 100% sure that you have high or low estrogen, particularly if you only have one of these on the list. But if you have a few on this list, it's an indication that you might be out of balance and have either high or low estrogen levels, and that maybe you'd like to take that a little bit further and actually get tested so that you know, because when we test, we know exactly what's going on inside your body, and then we also know exactly how to bring the body back into balance using natural supplements and herbs rather than guessing. And I told my story a little bit in my newsletter that went out on October 1st. And if you're interested in reading that, you can always go to my website, betterbrainhealth.info, and click on resources. And under that, you'll find all my past newsletters. And I've struggled with hormones being out of balance for much of my adult life. But when I hit menopause, it was different. My symptoms were slightly different, so I did have the wherewithal to ask to be tested again because I knew something different was going on, and I'm so grateful for that, because if I hadn't tested and I had just tried to treat my symptoms the same way I had in the past, I would have made the situation completely worse, because now, instead of having low progesterone, I was estrogen dominant, and so I needed to rectify that with a different remedy this time around. And in fact, all my hormones had got up and left my body, so I needed to address all of them. But in regards to estrogen, if you have, or these are very common symptoms of having high estrogen: bloating, erratic emotions and irritability, pounding headaches, uterine fibroids, fibrocystic breasts. We can often store excess estrogen in our breasts, and that can actually be one of the causes of breast cancer, so we have to be really careful around that. Water retention and weight gain, particularly around the hips, unstable blood sugar levels, joint pain, yeast infections that happen on a recurring basis, as well as breast or nipple tenderness. Now, on the flip side of that, if you struggle with low estrogen or you have these symptoms, it might be an indication of having low estrogen. Hot flashes and night sweats, which I hear people in their menopause years talking about extremely often. Fatigue, vaginal dryness, brain fog or memory concentration issues, osteoporosis, gas and flatulence, migraine headaches, so this was my issue, depression, frequent urination, decreased libido and lubrication, dry skin or brittle nails, as well as insomnia. So as I said, many people might struggle from insomnia. People might have gas and bloating for completely different reasons. People might have fatigue for other reasons. So this is not indicative that, oh my goodness, this could be my problem. But if you have quite a few of these, one of these lists, it might be something that you want to look into, particularly if there are things that are causing you to have a lower quality of life. You know, not feeling well sucks. And sometimes, though, we just kind of accept it and think, oh, we'll get through it. And then we get so used to it, we don't know how amazing it is to feel really awesome. It just becomes our new norm. So as I go through this month, I'm just trying to highlight that these symptoms that we struggle with are very common, and that we do need to listen to our body, and that we can fix them. We can help guide the body back into balance. So don't ignore them. Don't ignore your body talking to you. And there are ways that we can absolutely test to find out exactly what's going on for you, so we know how to bring your body back into balance. And it just takes all the guesswork out, and it makes the process a lot faster because we aren't throwing darts at a dartboard hoping that we'll hit the right solution. So I will be back tomorrow talking about progesterone. Thank you for joining me today. If you would like more information or would like to reach out to me, you can go to my website, betterbrainhealth.info. I do offer a complimentary 30-minute consultation so that you can get to know me, I can get to know what you might be struggling with, and we can determine if we're a good fit to work together and have me guide your journey to healing or bringing your body back into balance. So wishing you a wonderful rest of your day, and I'll be back tomorrow.